All right, so we're going to be talking about some major postpartum complications and conditions. So the first one that we're going to talk about is the postpartum blues. Postpartum blues are actually very common. So when we look at the risk factors, um, it could affect um, any women, regardless of their racial groups or cultural backgrounds. It's very common. It happens in about 50 to 80% of pregnancies. And so when we talk about the important characteristics, we'll see some moments of crying spells, difficulty sleeping, insomnia, anxiety, and overall feeling of feeling overwhelmed following the birth. These will usually have an onset within between the birth and the first 2 weeks. And so then in terms of nursing care, we do just want to provide some education and just let them know that this is very common. But we'll also do some follow up telephone calls just to make sure that um, check in on them, see how they're doing, do some telehealth calls. And then we could also just tell them to follow some relaxation techniques, going on walks, and maintaining a healthy diet to help combat it. And then usually this subsides on its own. So the next one we're going to talk about is the postpartum depression, which is similar to the blues, but some slight differences. So when we talk about the risk factors involved in postpartum depression, this would include having a personal medical history of depression, and this could be either during the pregnancy or before. Other major risk factor would be having postpartum depression in a other or previous pregnancy, or even having family history of depression or other mood disorders in the patient's history. And now, when we talked about the characteristics and how it separates it from the postpartum blues, so like we said, the postpartum blues could happen between birth and the first 2 weeks. For postpartum depression, this could happen within the first year, um, and it does maintain the same similar characteristics as the postpartum blues, such as the crying spells, the insomnia, the anxiety, the overwhelming feeling. Um, but with this one, the major complication would be that there are some safety concerns, as there could be suicidal ideations or even thoughts of harming the child. And the mother may also show some disinterest in the child. So when we talk about the nursing care that is involved in postpartum depression, we will have to really assess the mother's mood, but also we'll have to prioritize safety and just kind of do an assessment and ask her, has she had any ideations in harming the infant? And then we could also do what we did for the postpartum blues, offer some relaxation techniques, monitor the patient really closely. Um, and if it's not treated, it could last for many months. So it's important that they get the help right away. Um, and just really emphasize the importance of self care. Um, okay, now we're going to go on to the postpartum psychosis condition. And with this condition, there's a 50% recurrence rate, which means that a patient that has previously had this condition will have a higher chance of having it again. That's why it's important to really assess the patient's history. And another risk factor would be a first time pregnancy, especially in a female who has had previous obstetric complications. So now with this condition, it is way different than the past two that we talked about. So for this one, this does involve some visual and auditory hallucinations and deliriums. And the patient may also have similar qualities such as bipolar disorder, where they have episodes of manic phases and depressive phases. But what we really want to stress is the auditory and visual hallucinations that kick in. And there's sometimes moments where the delusions are often related to the infant. For example, the mother may think that the infant is possessed. And again, this leads on to the importance of safety, because the mother will sometimes have a threat or ideations to harm the infant. Um, and so, moving on to the nursing care related to this condition, we really want to emphasize the psychiatric help needed for this. This would require an inpatient psychiatric treatment. They would need to be started on some antipsychotic medications. So we would have some mood stabilizers and benzodiazepines. Of course, we want to encourage mother and baby contact, but for a patient with this condition, they will have to have their visits extremely supervised when the mother is in contact with the child. But also in terms of safety, we want to just ask her, like, has she had any ideations of hurting herself or the child, and really stress the importance of the safety. So now we're going to talk about the postpartum anxiety, which also kind of moves away from the other three, but it's kind of similar. So when we talk about risk factors, we want to look at the patient's own and their family history of whether they have a history of depression or anxiety in the family or the patient themselves. Another one would be previous loss of a child, or even caring for a child who has health conditions. That'll just raise up the mother's own anxiety levels right there and then. So the characteristics that are involved with this condition is that the anxiety of caring for the child becomes really takes over the mother's life. So it gets to the point where the mother is consumed with the worries throughout the day. It makes it very difficult, for example, to get some rest. The mother will stay up all night just because they have those worry or anxiety that the child will stop breathing. So we have those feelings of overwhelmed, but with this one, it's mostly associated with the anxiety. And you are just association with, just there's an association with irrational fears, and you're just constantly feeling on edge. So one major difference compared to the other two conditions like the postpartum depression is that not everyone with this type of anxiety are depressed. So that is one major difference. And when we talk about the nursing care involved, we will add in some medical treatments such as SSRI medications, and then we're going to try to get the patient some support groups, and then implement relaxation techniques, and we'll just encourage the patient to ask for help from family or friends, just to get a moment of rest, and just stress that self-care related to taking care of themselves as well. And that's my presentation.